Regine Webster with the Center for Disaster Philanthropy. Thank you all so much for dialing in today to learn more about the 4 famines that are affecting our globe. Hunger is one of the world's most solvable problems, and yet we're on the brink of not 1, but 4 famines in South Sudan, Somalia, Yemen, and Nigeria. Official famines already been declared in South Sudan, and more than 20 million are at risk of starvation in coming months due to drought and conflict threatening food security throughout the region. Humanitarian response must take place now to prevent deaths before they begin reaching peak levels. Over the course of the next hour, we're going to hear from several professionals working hard at work to navigate the famine crisis. We'll be joined today by Debbie Saidy, who's the Vice President of Public Policy with the World Food Program USA, Joel Charny, Director of the Norwegian Refugee Council of the United States, and Amanda Lanzarone, who's the Associate Program Officer with the Bill and Melinda Gates Foundation, leading the emergency response portfolio. So I have a couple of goals for us today through this webinar, 4-fold in fact, and I'll go ahead and read them off of my page for you all. If you all leave this conference call, this webinar today with these 4 things, I will consider our conference call a success. First, I would love it if you all left with an understanding of the food crisis, famine, and the causes of that crisis in Somalia, South Sudan, Nigeria, and Yemen. I'm hopeful that you will have a sense for the historical context of food crises in the region and an overview of how this problem can be solved. And last, but perhaps for me the most important, I would love it if you all left today with very clear and actionable steps that you and your organization can take to address the needs in this situation. So this webinar would not be possible without the generosity of the UPS Foundation. And I'm joined today also by my friend, colleague, and CDP board member, Joe Ruiz, who's the Director of Humanitarian Response with the UPS Foundation. Joe, thank you so much for your support, and I'll kick it over to you.
Thank you so much, Regine. And I want to say thanks to all of our esteemed panelists on the call today. I want to thank the Center for Disaster Philanthropy for being a true thought leader in disaster philanthropy and bringing to light the tragic events that are occurring with the famine. From our experience working with all of the leading humanitarian relief organizations, we know that events like global crises like the famine that's going on right now are not on the front page of local newspapers, and this is a true humanitarian crisis. We also know from experience in the UPS Foundation working with the leading agencies that they tell us that when natural disasters occur, they can get funding because of the television coverage that occurs. And the famine that has occurred and is occurring right now, affecting upwards of 20 million, and that number may be low. Our panelists will probably have updated numbers. That we know that not enough is being done, and much more needs to be done. I did want to say that the UPS Foundation has been proud to work with leading partners with UNICEF, UNHCR, the World Food Program, trying to do a little bit that we can to deliver high energy biscuits and other supplies. We've done shipments to Mogadishu, we've done shipments to South Sudan for bringing food and supplies and support for refugees in those areas that have been affected as well. It's not nearly enough, and I hope today that our panelists can amplify the needs that are out there, so the listeners on today's call can look within their organizations to provide help, whether that's funding, technical support, or any type of resources they can. So thank you again, everybody. I'll turn it back over to you, Regine.
Thanks so much, Joe. And again, thanks to you and the UPS Foundation. I also want to draw your all attention to, we're using Zoom as the platform that we're on. And if you wiggle your cursor at the bottom of the screen, you'll see a little icon that says Q&A. So if at any point in time during our conversation you want to hear, you have a question to pose to one of our panelists, you're more than welcome to type in a question in that chat box. Also, if for some reason you have to jump off before the end of the call, please know that this webinar is being recorded and you'll be able to access it through a link we'll send out later on our YouTube channel. Debbie, can I just invite you to dive in, please, and give us an overview of the region and the current food and famine crisis, and certainly your work and your role with the World Food Program USA.
Well, thank you so much, and I'd really like to express my appreciation to the Center for Disaster Philanthropy and to UPS for organizing this and sponsoring it today, because as was mentioned, as unprecedented as the situation is today, there's still not enough awareness about the situation across the famine risk countries. And I think I would just start with a first comment about how truly unprecedented it is. I mean, for famine to be declared is a major step, and it already indicates that we have, on some level, failed to come together as an international community, whether it's the getting the assistance to reach people or blocking access, or whatever the challenges, logistical or otherwise, are, to reach the state of famine is really a serious declaration. And so in South Sudan, we actually do have a situation where renewed conflict since the middle of 2016 has deepened the humanitarian crisis there, with women and children facing immediate risks of violence, displacement, hunger, life-threatening diseases. And as I go through the other countries which are at risk of famine, I mean, there certainly are some recurring themes, and there's no question that conflict is primary there. 9 of the 10 worst crises in the last year were conflict related. And so you have a situation in South Sudan where the risks have just been exacerbated by a rapidly deteriorating economic situation, inflation above 800%, and huge displacement. I mean, the numbers of South Sudanese who have actually left and moved into neighboring countries. Uganda has received a huge number of South Sudanese refugees, some of them arriving in a very poor nutritional status, has been a great concern. Conflict as well in Yemen has been a key feature, and that's destroyed much of the basic infrastructure, has affected livelihoods, displacement as well, a huge amount of internal displacement in Yemen, as well as refugees generated. Near collapse socioeconomic situation has really devastated the country. And so the situation in Yemen is one, it's actually the largest food security emergency in the world today. In the case of Somalia, of course, the last major famine that was declared prior to South Sudan was in Somalia in 2011. And drought conditions, and in that famine, we should say that several 100,000 lives were lost, 100,000 children died in that famine. And so we, again today, have drought conditions deepening in the north. They've expanded to the south and central region. And these drought conditions have, of course, affected crop production, reduced pastoral resources to support livestock, and put more people at risk. And then we have Nigeria, where years of violent conflict between the government, Boko Haram, and the northern part of the country have led to one of the most acute humanitarian crises anywhere in the world. And people have been forced to leave their homes. Insecurity has prevented farmers from accessing their fields. So this has led to compromised livelihoods and economic activity in the region. And what I would really want to stress is that famine can be averted. And although 3 countries that I've just mentioned are at risk of famine, there is still a window to be able to get urgently needed assistance in and to ensure that the 7 million children under 5 who are at risk will be, their needs will be met. There are a range of priority needs, operational focus that I can go into. But I think it's just incredibly important to understand that while the situation is dire, we know what to do, we know how to do it, we have the capacity, and really in many cases it's an issue of inadequate resources, which have caused us to sometimes make some extremely difficult choices, in some cases reduction in rations. But there is time, and the WFP has an incredible logistic capacity that can be mobilized. In fact, in the case of Nigeria, we did not have an office there until 2016, and WFP is now assisting a couple million people in Nigeria. So we've geared up. I would like to just comment on UPS being on the line, because I think the partnership there is just a great example of how the private sector can step up and step in, and UPS has assisted WFP just in the past week in terms of getting high energy biscuits delivered by air into Mogadishu. I think that, you know, one thing I would particularly want to highlight is even in the case of South Sudan, the people who are still inside the country are being reached with great difficulty. I mean, the logistics constraints are huge. And in many of these countries, including South Sudan, I mean, the rainy season is just about upon us. And what roads do exist are very likely to turn to mud in the months ahead. So WFP has been doing as much as it possibly can to pre-position supplies, to have them in place, to be able to meet the needs in advance of the rains coming. But we have also air capacity that we've been able to use in some of these circumstances to be able to get life-saving need to people at risk.
Thank you for that. Really, Debbie, I mean, I appreciate you raising the challenges, the solutions, and the facts as you have, and I'm looking forward to circling back in a few to ask you some more questions. But for now, I'll turn over the conversation to Joel, please.
Okay, thanks, Regine, and really a great deal of thanks to the Center for Disaster Philanthropy and for UPS Foundation for organizing this. And you know, we really depend on you, I think, in this current difficult environment to get messages out, to really highlight some of the situations that we're facing globally. So thank you for organizing the webinar. My focus, I was asked to speak to the role of operational NGOs, with Debbie having given the excellent broad overview of the overall situation that we're facing. And I really just have 3 brief points because I want to hear what the questions are and respond to those to the extent possible. But fundamentally, the role of operational NGOs in a situation like this is to get assistance to hard to reach areas. In recent years, we've, I don't want to call it a jargon term, but it's been within the last couple of years, we hear the phrase, the last mile. And what that signifies is you can get aid into a country, you can get aid maybe to the provincial capital, but the key is getting it to people in need in the distant villages and in the affected areas. I think what that really is the role, not only of international NGOs, but in some cases of national NGOs as well, to try to be present despite the conflict and despite the access challenges. So in the case of South Sudan, for example, the Norwegian Refugee Council, which I represent, you know, we're out there in 6 or 8 isolated areas where we were in a partnership with the World Food Program, where, you know, WFP will make sure that the food is delivered to a central location. And then in partnership with WFP, it's NRC that actually gets the food down and directly to people. And I think that partnership aspect of the whole humanitarian community trying to pull together is really vital in situations like this. Now, the food crisis is so severe that most major non-governmental organizations will have an operational food distribution component, either independently or, as I just mentioned, as WFP operational partners. And that's going to be true, I think, under current circumstances, even for NGOs that don't normally specialize in food distribution. For NRC, food security is one of our focus areas or core competencies, as we call them. So this is something that we have been doing, and it's fairly normal for us. But again, in the face of a famine, I think inevitably virtually all non-governmental organizations of any significant size and scope will be doing food delivery and trying to address the severe malnutrition that we're facing in communities that we've been working in. And then finally, with food as a given the extreme nature of the situation, then you start to see the complementarity, based on core specialization. So, an NRC is going to have a slightly different mix than the Save the Children, which is going to have a slightly different mix than Mercy Corps and so on. And in the case of NRC, in addition to food, we're doing emergency shelter. I want to stress the second component, which is water and sanitation and hygiene. In Somalia, for example, the killer as we speak is cholera. It's not famine yet, but people, because of shortage of water, they're very weak, and then they're drinking contaminated water, and they're succumbing to cholera. So that water, sanitation, and hygiene, WASH, to use the shorthand, is really vital, and really as a prevention of death from diseases, waterborne diseases like cholera. So shelter, WASH, non-formal education, not life-saving, but something that we think is critical to people's rights. We do try to build that in all 4 countries. And then land rights and legal protection, trying to look a little bit to beyond the survival phase and trying to think about how people will be able to access land. That's especially important in Nigeria, where the dilemma is that there are a lot of people in internal displacement camps stuck there who want to return, but it begs the question of whether they'll be able to access their land again. And NRC is working to support them in that process. The idea, of course, being to the extent that people can feed themselves, that's perhaps the ultimate famine prevention measure. So, Regine, back to you.
Thanks for that, Joel. I just was making notes of all the points, right? WASH, shelter, non-formal education, food, land rights, legal protection, and then certainly access to food. So appreciate that. And definitely, as with Debbie, looking forward to circling back. Amanda, you represent the Bill and Melinda Gates Foundation and the emergency response portfolio. I'd love to hear your thoughts on what you're doing, how you're preparing, and your current response.
Sure. So thank you so much for having me, and thanks to the Center for Disaster Philanthropy, and thank you to the UPS Foundation as well. I thought that I would start by talking a little bit about how our emergency response program operates in these contexts. I think that when we see emergencies that are really at their core drought related, we have a different approach than in the case of this famine and the other severe food crises. And that's because of the element of conflict. I think that the other panelists have highlighted, and it's a prominent feature of these food crises. And so in response to food crisis with an element of conflict, like we're seeing in Yemen, northern Nigeria, Somalia, and South Sudan, The Foundation's Emergency Response Program funds largely INGOs, international NGOs, like the organizations that Joel has highlighted, to rapidly respond to the most immediate needs. We give that money in a flexible manner. We believe in our emergency program that the flexibility for these NGOs is critical in order to be able to meet these most immediate needs. And so, for example, we have work in Yemen that initially was designed to address elements of the sanitation situation and coupled with livelihood programming. Now, given the food insecurity, our partners have the ability to shift that programming to the most important needs. We also give additional funding now as the crisis grows. In the case of Somalia, we've seen actually that in 2017, there have been unprecedented levels of funding. Almost $600 million have been raised in direct donations or pledges against an $825 million appeal. I think that some of these large commitments are now coming out of the learning from the 2011 crisis, where Deborah highlighted that we lost over 200,000 people to famine, over 100,000 children. Yet still, even with that large commitment, access remains a major challenge for these organizations that are trying to meet the basic needs. And we see that people are starving because really chronic conflict has destroyed their ability to cope with these periodic drought situations. And so again, we're working in Somalia with INGOs like the ones that Joel has mentioned, both to provide for immediate needs, nutrition programming around blanket supplementary feeding. We have in and outpatient treatment for malnutrition, as well as distribution of micronutrients for children and mothers and pregnant and lactating women. But beyond that, we're also doing some training of community health workers. And I mention this because I think that the local organization, local community health workers are also key in these situations due to our access constraints. When INGOs are evacuated due to security concerns, sometimes these are the people that are left on the ground to really meet the needs of the communities we're trying to reach. So again, our flexible approach really allows organizations to determine those key priorities and to apply the funds as needed. In northern Nigeria, the foundation has a number of investments in longer-term agricultural development as well, in order to give farmers better access to inputs like tools and seeds, so that they can garner a greater income off of their agricultural production. But when folks are fleeing due to violence and consuming their seeds and having to leave their crops before they've come to harvest, as we see in South Sudan, these agricultural development programs no longer function. And so then we're really requiring flexible and innovative responses. Something that Joel mentioned is something that also the foundation is looking to do regarding people returning in the north of Nigeria. As displaced people are returning, are there ways that we can help equip them to start their lives up and to increase their livelihoods, looking at interventions around small livestock or perhaps other agronomic practices that can assist people to get life started again? So I think in our emergency response program, really the key feature is the speed and flexibility with which we deploy the resources. When we're talking about drought without an element of conflict, there we try to incorporate longer-term programming that helps communities build resilience to cope with future shocks. In the cases that we're discussing today, those programs really aren't operational. We are working to reach the folks with last mile interventions, not to use a cliched term, to meet the most immediate needs around hunger. And Again, not including elements of water, sanitation, and hygiene, as we know that cases of diarrheal disease will increase as people seek out water sources that can be contaminated. I won't repeat the acute watery diarrhea information, but we're seeing that beyond Somalia, also in South Sudan. It is common. So I think I'll leave it there with the Foundation's approach, but open to clarifying with any further questions.
Thanks so much, Amanda. That was great. And certainly the three of you touch on different areas of the crisis and have different roles and responsibilities. I'm guessing that those of you who are on the line are buzzing with questions, so feel free to enter a question in the Q&A box so that in a little bit we can answer your questions. But I want to start by asking a question to Debbie. You know, you have, I had a chance in advance of this call to read your bio, Debbie, and you're so impressive. I'm just curious, with your expertise and your knowledge, how do you think the situation across all the countries is going to unfold in the coming months? I mean, like, do you believe that any of the other countries, the three other countries, are going to reach famine status? If so, what order do you think that will happen in? How do you see this playing out?
Well, thank you. We certainly are working as hard as we can with our partners to try and ensure that famine is not declared in any of the other three countries. I mean, there's really Herculean efforts underway, as Joel was highlighting. I mean, trying to reach people in some of the most inaccessible areas, and the access constraints. I mean, what I would say is that if we have the resources at an increased level, and, you know, I would just want to throw in here, I mean, I don't think we're really seeing donor fatigue. I think it's just that the needs are accelerating at such a rapid rate in terms of these four situations and other crises around the world, that somehow the contribution level is not keeping up with the escalating needs. But certainly the know-how is there, the capacity is there. I'd like to perhaps highlight one point that Joel talked about as well. I mean, on the partnership aspect and the sort of multi-sectoral situation, and this was also mentioned by Amanda. I mean, the issue is that the populations are in such malnourished states that this is where the disease burden really kicks in. I mean, inadequate dietary intake is really just laying the foundation for people to be at huge risk from whether it's cholera, malaria, or any number of other illnesses that can arise in these settings. And so making sure that, you know, the food gets there, that the access to clean water is also part of that. And so the partnership angles are key. But I would really stress that we believe that with the resources that are needed, and we do have partners on the ground. I think the point about working with local community health workers and trying to build capacity, strengthen capacity, and use existing capacity is absolutely critical. One of the clear lessons learned from many of the emergencies we've had to respond to, and something that was discussed a lot at the World Humanitarian Summit, was how to strengthen local and national capacity in the countries where these recurrent crises are. And on the issue of drought, I mean, certainly if one looks at the Horn of Africa, I mean, drought is a pretty predictable phenomenon, and somehow we have to move the paradigm from getting away from short-term infusions of emergency aid to really trying to work with folks on the ground, national governments, local partners, whether it's investments in resilience or whether it's really trying to ensure that the underlying causes of poverty and undernutrition are addressed so that every time drought hits, it doesn't push people over the edge into a crisis state. So I wouldn't want to predict in what order of severity we might see lives lost. I mean, we're trying to do everything. I know that all of our INGO partners and others are also working flat out to get the aid where it's most needed. But I would go back to the point I made earlier that we do have a window, but it's closing rapidly. And so the urgency of getting additional support out to the field is just so critical. So I would just say that now is really what is needed.
Debbie, there's a question that came in from the audience that's highly related to your remarks. So let me go ahead and have you answer this. How do access constraints impact the cost of delivering food aid? Hugely.
I mean, in the case of South Sudan, for example, I mean, if WFP has the resources up front to be able to do the procurement of the food, whether it's maybe it's in-kind contributions that have come in, or whether it's local regional procurement, and get the food positioned to those parts of the country which will become inaccessible also because of weather and rain and logistics, then that is really critical. To have to airlift food in or do airdrops multiplies the cost of the relief assistance tremendously. So on humanitarian access, I mean, there may be some circumstances where that access is limited because of conflict and one has to resort to more extreme measures such as the airdrops and airlifts. But then there are other aspects of accessibility which have to do more with the weather conditions and being able to not reach certain parts of a country because of limited road infrastructure and rains.
Super helpful. Thanks so much for that, Debbie. Joel, talk to us about how the NGO, the non-governmental organizations, are working in this crisis, and give us a sense. I know you talked a bit about the last mile and how you have a partnership with WFP, but what's the day-to-day picture look like, if you can paint that for us?
Yeah, these are obviously very challenging situations. We face obstacles. Well, first of all, the sheer scale of the crises means that it's A, difficult to overcome, but B, means we're mobilizing staff wherever we can find experienced staff to get in and to make sure that we have the skilled people that we need in adequate numbers to really oversee what are becoming very large programs. And because really all the situations, with the possible exception of Somalia, depending on where you're working, involve conflict to one degree or another, the whole issue of negotiating access while maintaining staff safety is really critical. And Regine, this is almost at the level of a moral dilemma. I mean, Norwegian Refugee Council, one of our 3 operational principles is proximity. We don't want to do remote management. We want to be close to people with our staff. And we have to balance that imperative with the real dangers that we're facing in, again, at least 3 of the 4 countries. So we're trying to improve our skill in terms of ability to negotiate access, talk to local government, talk to local armed groups to the extent that that's necessary, and be in a position to be present. So I think what I'm trying to convey, and then you have just basic bureaucratic obstacles which we encounter in all 4 countries. I mean, the kind of thing where you get permission to move to a particular location, and then you get halfway to that location, and there's some guy with a gun saying, oh, this permit that you have from, you know, the town 40 miles away is no longer valid, let's talk. So, I mean, so you either talk and try to get through, or you go back. I mean, little things like that can be very time consuming. But I think because of the sheer scale of the emergency, you know, we're going all out to overcome these obstacles. And, you know, what's interesting, I think, for the purposes of this call, is that the whole idea of funding and resources becomes really important, because to go through this, you need to have the feeling that that there's a financial backing behind it, that you're going to be able to deliver when you finally overcome these obstacles. So what I'm trying to convey, and I've felt this, it's a long time ago now, I won't go into ancient history, but you know, there really is an imperative to reach people urgently in these kinds of situations. So what I want to convey is just the sense of total mobilization that NRC is you know, summoning in the face of these crises. And just very quickly, I do want to say that the most dangerous situations, I think, right now, in terms of actually tipping into famine, or Yemen and South Sudan, both because of conflict. There's an effect, an embargo that's being imposed by the Saudi-led coalition on Yemen, which is making it very difficult to import supplies, both commercial and aid supplies. In the case of South Sudan, both parties to the conflict, or all parties to the conflict, are showing incredible hostility to aid organizations in the aid sector. So, I mean, we're doing the best we can to overcome these obstacles. But if I had to say, of the four, I'm most worried about Yemen and South Sudan.
And Joel, just for context, in terms of the calendar and time, how many years ago do you think it was that you told me to start paying attention to Yemen?
I don't know. I'm not going to claim any great prescience, but
you should claim some great prescience. Yeah, no, it was.
Well, I mean, it's just the minute the war started there, Yemen's a place, and the risk of giving this information is, I'm not trying to discourage anyone on this call from doing something, because as Debbie said, we can turn these situations around. But Yemen, in good times, imports 90% of its food. That's the killer fact about Yemen. So we're not talking about an agricultural system that normally feeds the country. They import 90% of their food, and a good part of the famine in Yemen it's entirely man-made. It's because of the war, and because these imports are being prevented due to the conflict. That's what's tipping Yemen into famine.
Okay. All right. Let's tip over now to Amanda to think about what the role is for funders. And Amanda, when I say funders, I'm thinking about, you know, private foundations, corporate foundations, community foundations. I'm not thinking funder in the multilateral, bilateral sense. So, you know, what advice do you have to offer?
Well, I think Joel is right in terms of need as reflected by the funding appeals and the humanitarian response plans. Yemen's is only 18% funded, and I think the appeal is for $2.1 billion. There was a high-level pledging conference in April where they raised some of that, but it has yet to be effectively committed. And so I think it's a difficult situation for donors, to be frank. I think that, of course, the needs are overwhelming in each of the contexts. If we look at northern Nigeria, since 2014, we've seen a quadrupling of needs in terms of dollar amounts. And so then how do we prioritize our commitments is a really difficult question, given the shrinking piece, the potentially shrinking piece of aid, humanitarian aid given by governments, and the increasing complexity of some of these crises. The short answer, I think, is that the way the Gates Foundation looks at this is we have a comparative advantage coupled with the humanitarian imperative. What this means for us is that we will respond in all of these situations that we're discussing today. But is there an area where we can do perhaps more than going beyond this traditional fast and flexible response model that I referred to earlier? And so I would encourage, private donors to do the same reflection. In the case of the Gates Foundation, we look in the case of Nigeria and we look around our organization and say, well, we've got some expertise in this area, let's say around agricultural development or around specific immunization campaigns or various programs around maternal or newborn health. Are there ways that we can leverage the expertise from those longer term programs that we have at the foundation and really translate them into a humanitarian context? Can we borrow some of those innovations? They might not be a magic tool. When I say innovation, it might be an approach. Perhaps the approach is just looking at the needs of the newborn in the humanitarian context, which are often neglected as we prioritize our areas of intervention. And so I think that in terms of a strategic approach, that's how we think. How can we multiply our impact by bringing in the other resources in our own organization? In terms of prioritizing in the 4 places, it's really difficult. The needs are overwhelming everywhere. And these questions around, access, who is the best partner, who can really reach these people, who has the expertise in various sector of implementation. And there we're in regular discussion with a host of NGOs, UN agencies, local governments as well, to really ensure that we can best apply our resources. Just to come back to the final piece on capacity, it was interesting to hear Joel talk about the NRC's commitment to being there. I think it is really important. And as our organization thinks about the kind of overwhelming cost and the overwhelming amount, really the cost of these crises and perhaps the resources that aren't growing at the same rate, we're thinking more and more about how we can help those on the ground, the community health workers, the local organizations, perhaps that's local staff of INGOs. But we also are thinking more and more about empowering the local actors, whether they're governments, organizations, health systems. So those are just some thoughts about how we're thinking of it. We'll stop there.
That's really helpful. I want to ask, Joel, throughout your remarks, you've highlighted several of the challenges that the NGO community faces, right? That first list that you laid out in your opening remarks: wash, shelter, food, land rights, legal protection. And then in most recently, you talked about the safety and security of humanitarian workers as another challenge. With all of those challenges staring you all in the face, if funders do nothing, how does this situation play out?
Well, if funders do nothing, we're then wholly dependent on basically governments and other institutional funders. And I think the challenge there is there are gaps. And I mean, if I can answer the question that you posed to Amanda from an NGO perspective, my answer would very much reinforce the Gates approach. I mean, basically, the total appeal for these 4 countries is $5.6 billion, and only about 30% of that appeal is funded as of the end of April. Now, I'm just putting myself in the shoes of maybe a small family foundation or large or medium-sized private donors that may be on the call, those are immense numbers by any measure. But there are gaps in the funding that NGOs receive from institutional donors. So the Gates idea of flexible funding is huge, even if it's a small amount. A small amount of flexible funding, might give us the ability to, fill a gap or respond in a way that we're not able to do right now because of, limitations that the larger donors place on us. And even if flexible funding is sort of, too scary or too big of a challenge, I think working together with a potential funding recipient and figuring out what that, what will that 50 or 100 or 200,000 or $300,000 do, even in the context of a crisis so massive, there are places to play a role. I mean, Regine, I can't sit on this call and say, I'm not going to guilt trip everybody and say people will die if the foundation community or private donors don't step up in the U.S. I'm not willing to say that, but is there a role for private support? Absolutely. No matter, even though the crisis is so big, there's definitely a strategic role for private philanthropy to play, and I think any one of us would be happy to discuss what that role specifically might mean for Norwegian Refugee Council or other organizations.
Yeah, that's a great point. Thank you for taking that question on. I appreciate it. Backing up a little bit to think about the historical context. Debbie, can you speak to the underlying issues behind the food crisis? And I know that conflict is certainly one of them, one if not the main one. And then also along with that, if you could speak to any of the lessons learned that your organization have realized since 2011.
Sure. Well, thank you. Well, I think the slide that's on the screen now, which highlights the numbers of places where conflict and drought are creating hunger today, certainly the conflict factor is overriding. But we mustn't overlook the issue of climate change. I believe last year there were 22 million people who were displaced for climate-related events. Underlying poverty, inequality, to some degree urbanization, all are contributing to the crises of hunger in countries that are highlighted there. And I think one of the things that we need to be mindful of is that even as we talk about and focus on these 4 crises, it's a relatively small number of high-profile emergencies that are dominating the food assistance funding. And one thing that I would say is that to the degree to which funding in support of ongoing nutritional activities, and I hats off here to the Gates Foundation for much of the work that they're supporting. We see in so many parts of the world that the fact that the vulnerabilities that put people at risk as a crisis hits or as a weather event hits are not, those investments are just not being made. And we're seeing over and over, I mean, I think in Southern Africa, if we look at a region with no conflict, we have the situation where, we recently had a major drought affecting about 13 million people. There was early warning, there was an effective response, and lives were saved. There was no loss of life that occurred. And I would perhaps also call attention to Ethiopia, because Ethiopia, as we know, in the 80s experienced famine, terrible loss of life. But Ethiopia today is actually an example of one of these countries that is out of the limelight, out of the spotlight, but has experienced major El Nino effect over the last year. This year, the prognosis in terms of food security because of climate is also not positive. But the Ethiopian government has taken steps and taken measures, putting in place a productive safety net program, making commitments of its own resources to address this. And I think that, you know, one can also look at some examples where there has been progress and where national governments and local partners need to be supported to continue in that direction.
Thank you for that. Thank you. I want to turn now, sorry for the hard paragraph return here, but I want to turn now to make sure we answer some of the questions that are posed by our audience member. Joe, I hope that you are still on the line here, but we have a question for you. What does the UPS Foundation as a corporate foundation particularly look for while selecting humanitarian partners? Also, how best can we bring in emergency preparedness measures into partnerships with corporations, given that the nature of funding tends to lean heavily on the response side instead of contingency planning and preparedness?
I am still on, and well, our strategy is around working with the agencies that we know will respond to 90% of the global crises in the world. So each year at the beginning of the year, we allocate emergency funds, in-kind budgets. For instance, last year we did 6 charters and over 1,500 metric tons of relief goods for the refugee crisis. And we realized that most corporations, focus on areas where they have operations, where their people are. But as a company, as a global company, I think we saw, and this is probably a great reason for corporations to get involved, is that originally the refugee crisis was not an issue for most corporations until it became an issue that moved into places like Europe. And it is, I've often said, there with the millions of people that are stateless and are internally displaced, that if these fragile economies will suffer, and those will have significant impacts on the private sector and corporations if these economies, due to the challenges of trying to support the 65 million refugees the UNHCR is trying to support. So our efforts are directed by the leading relief and response efforts. We also are very conscious of the effort to move forward into disaster risk reduction and mitigation. There are areas like the new UN Connecting Business Initiative, which was launched at the World Humanitarian Summit. We work with organizations like the UN Organization for Disaster Risk Reduction. We have loan managers who are putting into capacity building roles, working with agencies, donating them for 6 months to help them improve. We just finished a project with the Refugee Agency to help strengthen their fleet in East Africa to be able to help respond to things such as the South Sudan crisis. And that's one of the things that I hear often, that that these agencies can use is the expertise and the skill sets and the technical capabilities and the technology that private sector companies offer their people. So if you don't have a lot of funding to give, you certainly have great resources and technical capabilities that these humanitarian agencies can benefit from.
Thank you for that, Joe. I want to turn now to another audience question or participant question, and we're going to do it in lightning round. So Debbie, Amanda, and Joel, lightning round question and answer for you guys. What do you see I'm going to ask you to name 2 critical gaps in the current response effort. Debbie?
Well, I mean, apart from resources, the other is the political will for humanitarian access. I think there just needs to be a huge push on governments in the countries where we're responding to ensure that the assistance effort is facilitated.
Okay, money and political will. Joel.
Money and political will. No, I mean, I'm not being facetious. I'm so glad that Debbie mentioned political will, and I know there's little perhaps our listeners can do about that, but it absolutely must be said. We need more diplomacy to solve these conflicts.
Amanda, how about you?
Yes, I couldn't agree more with my fellow panelists. It's absolutely true, and it's an area where we don't do much at the Gates Foundation around political will, but as individuals, we all do our part there.
Well, that is great. I'm glad that we have consensus on that, and certainly I know I'll be thinking the rest of the day how we can bring political will to this, and certainly at the Center for Disaster Philanthropy, we often push for more resources to be generated or attended to a particular disaster crisis. So completely agree with that. Joe, we have one more question for you.
Can I add, Regine, just on the resources part and regarding what Joel had said about the flexible funding? I mean, I know as our organization went through setting up this rapid and flexible response mechanism, we had our own challenges. And so I just would like to say to private donors that we would be happy to share our approach and to share how we were able to model that program, if that would facilitate other private donors who I think will be more and more important as we move ahead to fill these gaps.
Thank you for that offer. That's a terrific offer. And if anybody wants to get in touch with me, I'm at regine.webster@disasterphilanthropy.org, and I can certainly put you in touch with Amanda to walk through that. Oh, there we go. Actually, all of our emails just popped up. So it's amanda.lanzarone @gatesfoundation.org. So you're more than welcome to email her directly. Joel, Joe, last question for you. A case can be made for multi-year support by corporate and institutional donors to really address the multiple impacts of humanitarian crises and institutionalize preparedness measures, especially in cases where it's reasonably foreseeable. And Samira Khalid, I'm sorry if I'm saying your name wrong, but was hoping to get, Joe, your thoughts on that. If you can give a brief 30-second answer to a really hard question. Okay, well, maybe Joe is muted, so we will get back to you on the answer to that question. We'll have Joe circle back. We have come to the top of the hour, and I just want to thank you all so much for joining us today for this webinar to discuss the 4 famines and the way that funders can be attentive and respond effectively to the disaster. I would specifically like to thank Joe Ruiz with the UPS Foundation, Joel Charny with the Norwegian Refugee Council, Amanda Lanzarone with the Gates Foundation, and Debbie Saidy with the World Food Program of the United States. That is all the time we have. If you have any questions, by all means, email me. I'd be happy to get information to you about the crisis. We're looking forward to being in touch with you all soon. So thank you very much and have a great rest of your week.
Thanks, Regine. Take care.
Thank you.
Thank you.
Bye all.